Y se ve como hay una entrada aquí.
It's 5:30 a.m.
Okay, I think we should put one here.
and this pre-dawn blitz at a Toronto subway station is targeting Latino workers. Sebastian Mendoza Price and Fernanda Yanchapachi put up posters to promote an upcoming vaccine clinic. In the race to vaccinate, this is the final grueling stretch. And Fernanda says it's all about finding the final holdouts.
Why is it important for you to come here?
We cannot rely on social media or the radio. We have to go where the workers are, the spaces that they visit, the places that they transit, where we can find as many people as we can. Información sobre una clínica de vacunación.
The strategy is hyper-local, hyper-focused.
Información sobre una clínica de
But it's part of the
vacunación.
bigger
Buenos días.
goal to get 90% of eligible residents in Canada's largest city double vaxxed.
Hola, buenos días. Tenemos una clínica de vacunación.
And that means
Comparte
breaking
con tus
down
amigos.
any barriers that still remain.
Hola, buenos días. Being out there before 7 a.m. is really important to establish a relationship of trust. And then speaking to folks in their language, that kind of also allows them to maybe ask some questions, which I think helps build community support and trust.
Building trust in communities with lagging vaccine rates is key. About 340,000 people in Toronto don't have both shots. About half of those don't even have one. In the Latino community, undocumented workers are among those least likely to get vaccinated. At this clinic, there's no need to present a health card, and there's no language barrier either. Wilfredo Rivieros is getting his first dose. Many people we meet on this day are too. Like Fausto and Dalia Caudelo, who came here right after someone handed them a flyer in Spanish.
Sí, es la primera. Tenía problema por ponérmela o no si tenía el seguro.
It's our first shot, he says. We didn't know if we would be eligible to get one.
Ningún problema y por eso accedí a ponérmela.
Lack of access has been an ongoing concern. So is lingering hesitation. Jorge Filmas is a scientist volunteering with the Latin American COVID Task Force. Misgivings, he says, are still largely rooted in misinformation about vaccine safety.
You have to be persistent and say, okay, what are your questions? What are your doubts? And try to explain that and in plain language and trying to, reach to, what is the side that people will be more receptive, trying to find what is it that really will click and make them really change their minds.
It can be a lot of work, and it comes down to getting to one person at a time.
People will see something like this and they'll see all the effort, and maybe they'll get 10, 20 people here tonight. So to you, is it worth all the
yes, it is. It is, because there is still, I would say, probably a larger number of people that we can convince them. I'm optimistic, and slowly, but we are doing that. But, now it's slow. It's one by. You're winning people one by one, as opposed to before they were, by the thousands.
Among the holdouts, there are anti-vaxxers who won't be convinced. But the hope is most people who are hesitant can be swayed. Many live in racialized communities with higher rates of essential workers, areas that have been disproportionately affected by COVID.
Hello, we have Pfizer, Moderna. You need your vaccine.
That data is driving this final precise push. The City of Toronto is setting up pop-up clinics at subway stops in those communities to make it that much easier for people to stop and get a shot, and to remind the reluctant of what is at stake. And it is a race against time and variance. Cases in schools are spiking. In some hard-hit areas, it's come down to identifying residential buildings with lower vaccine rates and parking mobile clinics in front of them.
Sometimes it's difficult to make time, so this was, I'm on my way to work and it's just, okay, let's do it.
It can be slow going because the same old doubts have set in for longer.
They go door to door.
Karma Lamo is with the neighborhood organization in Thorncliffe Park.
Some people had concerns,
about the way it was rolled out. They think it was too fast. They have doubts with government or just being told what to do. But we talk about COVID cases, we talk about how the Delta is spreading, we talk about how people are reacting who are vaccinated versus non-vaccinated. So people tend to come around after the end of the conversation.
Are you surprised that at this point people are still hesitant?
I'm not, because this is a public health issue. When I get vaccinated or I'm maxed, I'm protecting you. I'm not just thinking about myself. So I think if that thinking were to change, that would make a difference.
Hello, how are you doing?
And all this could make all the difference, could tip the scales and get to herd immunity. At an evening clinic in another vulnerable part of town, the tone is informal, inclusive, and as night sets in, the lines do get longer. Volunteers Fernanda and Sebastian, who have been at it from dawn to dusk, say they'll keep going.
When you're protected, then it's also a way to build that power and that confidence within our communities.
It has been an awful 18 or 20 months since the pandemic started, and a lot of people have died. I want to make sure that no more people die, that everyone is protected.
There is no clear finish line in this final lap, but there is an urgency to get there, one strategic shot at a time. Joanna Rumaliotis, CBC News, Toronto.